So, simply stated, what is stroke? Stroke is any sort of a lack of blood flow to the brain, and this results in a lack of oxygen, which then causes a whole sequelae of injuries to the brain because of this lack of oxygen. So it can occur not just from the typical type of stroke that we think, but this also includes aneurysms. And this has been one of the things that has also increased. We used to look at stroke and then pull out and separate aneurysm from that. But that has actually been added. And so this is something that we're seeing on a more frequent basis. So an ischemic stroke is caused by a clot that blocks a vessel, which then limits the ability to have blood flow and oxygen to the brain. And when we look at this, this is ischemic strokes result in 75 to 80%, depending upon the research, of all strokes. It is the most common type of stroke. There are three basic types of ischemic strokes. You have your thrombotic, embolic, and lacunar. Thrombotic stroke is where you have a piece of where there's a clot or a piece of debris that blocks the blood flow, and typically this is occurring because of bad vessels. So, for example, a lot of plaque buildup from atherosclerosis, or think about your long-term diabetics where their vessels just collapse onto each other, blocking the blood flow. So those tend to be what we see mostly from a thrombotic standpoint. Embolic strokes occur when you have a piece of debris that is dislodged from another part of the body and then moves through the bloodstream up to the brain and blocks a vessel there. Typically, this occurs because of issues related to the heart. So you see a lot of individuals with AFib. In fact, someone who has atrial fibrillation has a 5 times increased likelihood of having a stroke than someone who does not have AFib. You also see clots thrown from the heart for endocarditis or buildup around artificial valves. The other things where we are seeing an increase are due to some of the blood clotting factors, and these are genetic factors.